And now to our State of Addiction report tonight. New information on the proposed safe injection site bill that goes to the State Assembly Health and Public Safety Committee tomorrow. Tonight, two Santa Cruz County supervisors are taking a stand against it. Action News reporter Phil Gomez with more from Santa Cruz.
After our story ran last week about the proposed safe injection site bill, Santa Cruz County Supervisors Bruce McPherson and Ryan Coonerty wrote this letter to Stockton Assemblywoman Susan Talamantes Eggman, stating Santa Cruz County is actively working on strategies to address opioid addiction, but an injection services program is not part of the county's approach. Please remove Santa Cruz County from AB 186. Santa Cruz County Public Health Director Arnold Leff agrees and told us the county is not ready for a supervised injection program.
We don't need another drawing site, so to speak, here for us to have to deal with that. And so we are on board, and as is our health services director, to say we don't need this here right now. We have enough on our plate.
This bill came as a surprise to us. Nobody in Santa Cruz County had been contacted, and while we appreciate efforts to look at any new innovative strategies on public health, we don't have the capacity to take this on right now.
Some of the concern is that such a proposal would increase crime, draw drug dealers down to prey upon addicts, and would lure more people from across the state to Santa Cruz to use. 29th Assembly member Mark Stone needs more information before he makes up his mind on the bill. But even if AB 186 passes and includes Santa Cruz County, it would ultimately be up to the Board of Supervisors to move forward with it if they so choose.
It's not prescriptive, it's completely permissive, so it would be up to the county to decide. I do applaud Ms. Talamantes Eggman for at least trying to do something that would get at opioid addiction to stop some of the deaths that happen around it.
Santa Cruz was reportedly included as one of the targeted counties for the legislation due to its high opioid overdose rates in recent years. It's been used in Europe and Canada to steer users toward treatment and reduce deaths.
It has been used in Europe, and there is some evidence that it can be effective, but the data is very limited. There is also a program in British Columbia, and also there the data is somewhat limited.
According to Assemblywoman Eggman's office, even if approved by the Assembly, only the county or city in question can authorize and permit a program with ample time for the public to weigh in. In Santa Cruz, Phil Gomez, KSBW, Action News 8.
Thank you, Phil. The ACLU supports the bill, saying it would prevent some of the most devastating consequences of substance abuse, including drug overdoses, HIV, and hepatitis infections.